My name is Josh Levine, and I am an ear, nose, and throat surgeon at Charlotte Eye, Ear, Nose, and Throat. One of the reasons I wanted to become a doctor rather than just a specialty is when I was a little kid, maybe 8 or 10 years old, I tried to play lacrosse and I was not very good at it. I wasn't wearing a helmet and I got hit in the face with a stick. Of course, my parents were panicking. They were worried that I was going to get a scar on my little face. And I went to the doctors and they brought in a needle, of course, to give me an injection and some suture. And they said, we're going to sew up your face. And my mom was panicking that I wouldn't be able to do this while I was awake. And I said, can I get a mirror? And the doctor said, why do you want a mirror? I said, because I want to watch you sew up my face. And so I had a mirror and I was holding the mirror up above while he was sewing up my eyebrow. And I looked at my mom and I said, this is what I want to do. This is a great thing to be able to sew somebody's face. You can work with your hands, you can operate, and you can have fun at the same time. And for even an 8-year-old, I enjoyed watching that. Choosing an otolaryngologist or ear, nose, and throat specialty, it's an interesting specialty because we get to deal with all kinds of age groups. So we see young children, we see adults, and we see all kinds of different aspects of specialty. I'm actually a sleep doctor as well, and so I have board certification in sleep medicine in addition to ear, nose, and throat surgery. And so I get to treat people with sleep problems. That includes sleep apnea, they might have insomnia, you can have restless leg problems, just problems falling asleep in general. And then I also get to treat children with ear infections or they need tonsil surgery, adults that have sinus problems, all different aspects of medicine that we see in ENT. Where I went to school for undergraduate school was Duke University. That's the Duke Blue Devils, which is the best basketball team in North Carolina. And that was for undergrad. I was an art major in undergraduate school and also, of course, a science major. And then after that, I went to Boston University School of Medicine, where I did my medical school. I did my residency at the University of Miami, and that was my general ENT residency. I did a fellowship in ear surgery in New Zealand, in Christchurch, New Zealand, for a year. And then after that, I came to Charlotte, spent a few years, and then became a sleep physician here in Charlotte as well. My time off is very, very busy. I have 2 children, they're 8 and 10, 2 little girls, and my wife, and she's a pediatrician, and we spend a lot of time outdoors. So we do gardening, I do a lot of mountain biking, we go camping and hiking, we like to travel as well, and we like to eat a lot.